Hey everybody, it's Dr. Seiler from Seiler Skin, and we're going to do a cool treatment with a little bit of filler today. My wife Jill, she's noticed just a little bit of kind of lack of jawline definition as she's gotten a little bit older, and a little bit of neck laxity in the upper part of the neck. And so what we're going to do today is I've identified a couple of areas along her jawline that could use just a little bit of volume replacement, where you have some of the fat pads that shrink with age a little bit. A lot of these things can be subtle improvements but make a really nice difference for the patient. And so you're going to see me inject a little bit of filler into her chin, a little bit of filler into kind of this part of her jaw right here, and a little bit into her posterior jaw. And in effect what that will do is that will give her a nice, more proportionate shape to her face. She's got good cheeks, so she's got pretty good height to her cheeks itself, but we're going to give her a little bit more jawline definition that will help to kind of lift the lower face and the upper neck and give her a little bit better definition. So we're going to get started. All right, so first we've done a little bit of ice. We always clean the skin before, but I use alcohol before each little stick just to make sure we're super clean. We're going to use our cool little AccuVein device here to show me if there's any little blood vessels. Come over just a little bit. All right, perfect. That's a great little device to help me keep from bruising the patient and keep from injuring any blood vessels. We're going to do our first little stick right here. Do my little wiggle to kind of distract them, and that way that she doesn't feel anything. And I'm going to put a little bolus of filler right here. You okay? Mm-hmm. Feel much? Not too bad? Mm-hmm. This filler's got a little bit of lidocaine in it too, so once that kind of kicks in, then they're really numb. So this is actually a pretty simple and very safe procedure to do in the right hands if you have an expert injector doing this for you. And this will give her just a little bit of jawline definition. We're using Voluma in this treatment, which is the thickest of our HA fillers. All right, let's see the AccuVein real quick again. Perfect. Okay. Now we're going to go slightly behind that. Just give another little bolus right here. Usually you feel just a little pinch, but shouldn't be too bad. Aspirate to make sure we're not a little blood vessel, and give just a little bitty bolus right here. So all in all, we've only used about 1/10 of a syringe total, just to give a nice little bump to that. And like I said, little subtle changes with filler. You don't have to put a lot of filler in people. Little subtle changes with filler make a big difference for the patient. Do one more little stick right here. Go through that. You're okay. I'll go through the same little spot that I did before. Do just a little bit more right there, and then we'll kind of massage that in real nice. And I am pushing kind of hard on this to get this to kind of pancake down just a little bit on the jawline. All right, let's go ahead and ice our chin. So we're going to do just a little bit dead in the center of the chin there. And again, I only used a little over 1/10 of a syringe to help with that. She's got good definition right here in her jaw, so we're going to leave that part of it alone. And then after we do the chin, we're going to come back and do the posterior lateral jaw. Okay. Good there. Wipe our chin again real good. And turn, yep, let's see. Okay, perfect. All right, so this one is, I'm going to try to stay out of the camera here. This is just a straight on injection right in the center of the chin. You can see that even at this angle, I'm good enough to aspirate so we know we're not in a blood vessel. It's very important so that you don't damage the structures. You can see that I'm giving just a little bit of a bolus here. I'll probably put in about 1/10 of a syringe just to give her a little bit of projection, maybe a little over 1/10. And again, that's going deep on the bone, so that will give her a nice little projection. She wiggles her chin pretty good too, so we're going to come back in about a week from now and put a little bit of Botox in the mentalis muscle that makes her wrinkle, so that will also help to relax her chin so that she gets a little bit of projection with it. All right, let's turn away from me just a little bit. All right, let's go ahead and ice right through there. We're going to do a couple of injections. My wonderful cosmetic assistant is doing a great job of assisting from the other side of the table here, so she's multi-talented and multi-handed.
Definitely.
Usually they're on this side of me, but we're trying to stay out of the camera, obviously. All right, that should be good. Do just a little bit of alcohol wipe here to make sure we're good and clean. All right, go ahead and see if you can give me that angle right there. Perfect. Okay, good. She did have a little bitty blood vessel right there, so I'm glad we saw that with the little AccuVein device so we can avoid that. Grit your teeth for me. Okay, so we know that we're deep to the muscle here. We're all the way down on bone, which is what's going to give her a nice prominence to the jawline, help to give some definition. And you may be asking yourself, why do we shrink the masseter to reduce that fullness? Well, the masseter bulge is usually a little bit higher than where the jawline is. So in some patients, we do have to put a little bit of Botox in the masseter to reduce that so that they're not wide up here like we've done in Jill. We've done that multiple times for about a year or so to shrink this up a little bit so she's got a nice contour to her lower cheek or lower face area. And then we can come back and rebuild the, here, let's look one more time. Rebuild the jawline just a little bit. Okay. Believe it or not, you start to lose bone as early as even your teens, but most studies show that the early 20s, you're really starting to kind of resorb bone a little bit. And so just a little bit of filler on the bony margin of the jaw can really help to define. And obviously you don't want to give a woman too strong of a jaw. You don't want to masculinize their jaw. So just subtle little improvements right here really can make a big difference. All right, let's look here one more time. All right.
I think to explain, trying to kind of direct attention away from here.
Yeah, right. And you know, she's got just a little bit of fullness here. We've treated this with cool sculpting, but this still bothers her. A little bit of it is from just kind of ducking her chin when she looks at her computer or her, you know, cell phone. But giving this a little bit longer of a length and a little bit more prominence will give this a straighter or more of a 90-degree angle, so it takes the eye off of that little bit of bulge right there. All right, we got one more little stick. Okay. This one's a little higher up. This is where you got to be careful that you really know what you're doing and you make sure you aspirate when you do this, because you are getting a little closer to bigger blood vessels and you want to make sure you don't put any filler in those or damage them, obviously. So this should only be done by a very expertly trained and experienced injector there. All right, so we've used half a syringe. We're going to use half a syringe on the other side. We may come back after 3 or 4 weeks when this really expands and kicks in and feel like we need a little bit more. It's probably a little hard to see on camera, but I have lengthened her jaw just a little bit. We've softened this so that she doesn't have that tiny little beginning of the jowl area right there. We also put a little bit of Botox in what's called the DAO muscle here a couple of weeks ago to keep her from pulling down. And it's helped to just elevate her lips just a little bit so she has a little bit more even and better kind of corner to the mouth area there. And now we've replaced the jawline just a little bit with filler, and you can see minimal bleeding and all, so she won't bruise at all. So this is the jawline and chin enhancement with a little bit of Voluma. And if you're interested as a patient, we'd love to see you. And if you're interested for training, check out our website. Our patient practice website is seilerskin.com, and our training website is seilerskinai.com for Aesthetic Institute.
Okay.
Thanks for watching.